Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton. And today's guest is a repeat guest, a good friend of mine based here in Hoboken, New Jersey, lactation consultant Carmen Baker Clark. We work together often supporting dyads with breastfeeding challenges, especially those first few weeks of life. She's an amazing IBCLC and has 4 adult sons of her own that she breastfed all and has just 30 years of experience personally and professionally with nursing her own babies, becoming a Leche League Leader, and then continuing on to get her certification as an international board certified lactation consultant in 2005, where she's been continuing to work in private practice, doing home visits. And in 2008, also began working locally at the Hoboken University Medical Center Hospital. She has worked with thousands of moms and babies every year, supporting them in feeding. And what she's found with all of this experience is that feeding challenges has multiple causes. And a lot of that can be related to tightness or tension in the baby, either from positioning in utero or from the birth process. And so today's episode, we're going to shed some light on how the full body mechanics of baby and movement or lack thereof impacts the baby's ability to feed, as well as normal developmental milestones. I hope you enjoy. Hi, Carmen. Welcome to the show. I'm very excited to have you on for the second time.
I'm very excited to be here, Laura. As always, I appreciate you putting something like this together and making this available to our audiences.
Yes, definitely. So Carmen and I have known each other a long time. You were one of my first podcast guests. We talked about bed sharing and how it relates to breastfeeding. And I think you wanted to give some updated guidelines on that today. But we really want to focus on essentially how movement during a woman's pregnancy, movement during birth for mom and baby, and then the baby's movement during their early infancy and how that impacts that baby's development and specifically how it impacts feeding.
Correct. It's something that I have had the opportunity to think a lot about because particularly I've always sort of felt this, but particularly heightened with the pandemic. And observationally, there's no studies or anything like that, but observationally, we are seeing more and more babies with difficulties feeding due to being in very tight positions in utero and not getting enough movement felt by the mother's movement. And I've actually began asking parents, were you able to get out and go for walks during the pandemic? Did you stay inside all the time? Or did you feel like you had to, did you regularly go out for at least a walk occasionally or something like that? And I see a difference, my own observations between the mothers that tell me that they were staying in home and not doing much other than sitting and working at their computers, or moms that regularly went out for a 2-mile walk every day. And I see it in the babies' posturing, their muscle tone, they're looser, they're more fluid, they're more flexible. And the mothers that were more sedentary, unfortunately, due to the pandemic, those babies were a little more tight and more restricted in movement.
Okay. And this makes so much sense. Like, this is a musculoskeletal impact.
Right. Yeah. Right. So a little bit about my background and how I am so fascinated by this is the fact that I was a professional ballet dancer. I'm a trained dancer, a trained choreographer, and I did that before I had my own children. And I noticed a big difference in my first child and my second and third. Well, in terms more, I moved and I danced through all my pregnancies. And even when I had my babies, I wore them like in a carrier or a sling and went back to teaching dance early on. But there was the only one that I had a little gap in this pattern was the child my first one, I didn't know about slings or baby carrying. I did wear him a lot, but he needed a lot more movement for whatever reason. And I didn't figure out the movement piece until he was about 3 months old. And at that point, I began wearing him in a baby sling a lot more, because he was just seemed a whole lot more settled and he had easier access to breast. And so I did my everyday life wearing him. So he experienced a lot of my daily movements. He had more difficulty crawling in an organized, correct manner. A correct crawl didn't happen for him until after he had started walking. He was one of those scooters, and he ended up figuring out how to pull up, and he ended up figuring out how to balance and how to take steps. Then it was after he did that he began to crawl. My children that I carried from day one after birth crawled on their 6-month birthday perfectly. The perfectly coordinated right hand, left knee, left hand, right knee crawl. And of course, walked even earlier than my first child in a very coordinated manner. I mean, they were all walking by 10 and a half months. Well,
yeah, that's early.
And running and climbing by about 12 months, So that was my skewed vision of the world, but that's because they were exposed to a lot of movement because I was a mover myself.
Right. And you have 4 sons.
Yes, I do.
Yeah.
So I got to experience that, my own little N of 4 experiment.
Your own social experiment.
Yes. And it also was easier to calm my babies. I found that had an incredible calming effect to just move and to follow my instinctive movement. And so how does that play into today? As I work, as you know, both in a hospital setting and as a private practice lactation consultant. And I'm constantly dealing with sometimes some very challenging situations, sometimes not so challenging, but in those challenging situations where these babies have difficulty latching, there's always a physical component, not just in terms of how we position the baby to the breast, but how that baby holds itself when we're trying to position him in an optimal position where he will have a nice deep latch and he won't injure mama. A lot of the injury happens, yes, number one, due to poor positioning. Latches are too shallow, and other related factors. Then we have a lot of tongue-tied babies who aren't able to create vacuum and pull that nipple far back into the mouth so that it doesn't injure the nipple, and use completely the wrong biomechanics to extract the milk. So that also causes injury. But in compounding that is also some very high shoulders, some curve positioning, lack of extension of the neck back and opening that throat up and having the ability to open the jaw widely, unhinge there. And sometimes it is related to that tie, but sometimes it's also related to that positional impact, that position in the womb. That intrauterine position has tremendous impact on a baby's ability to latch on without causing a mama pain. And how does that intrauterine position come about? What was mom doing during the pregnancy? Were we always sitting slumped on a chair in front of our computer working for most of our day? Were we not moving a lot? Maybe it was because of bed rest requirements. Maybe it was just because of work requirements. Maybe because of fear of the pandemic and being outside.
Carrying a toddler only on one hip.
Also, if that's right. Then the baby, or whether that baby was sharing space with a low-lying placenta or fibroids, things like that. Or
another baby.
Twins, indeed. And interesting positions that they find each other. And also maybe breech positions and transverse breech, frank breech, a baby whose actual head is stuck under and between mama ribs. That baby's ability to move inside the womb is restricted, So it is kind of a classic situation where I find that that baby I'll have a difficult time right off the bat immediately. We're supposed to be doing skin to skin contact immediately after the birth of the baby. That baby comes out and we place him in skin to skin. Even in the hospital that I work with, we are doing skin to skin in the OR. So even when we have a C-section, that baby will have access pretty quickly onto the breast. But if they were in a very restricted position in utero, it is hard to get them to latch on, just hard to get in position in a way that they can actually latch on without causing pain for the mama.
Yeah. So in utero position is a big part of that. And then the birth itself can create strain on that baby's alignment and muscle tension. And it all boils down to what position is this baby comfortable in, right? And how is that going to support them in feeding?
Yes. And so I have found that my number one tool, so how do I help these babies, okay? How do I help? My number one tool is to put babies in true skin, immediately after birth, in true skin to skin. By true skin to skin, I mean as much body, frontal, ventral, contact all the way, legs and everything as possible against mother's body for as much time as mom can give her baby. She acts like her baby spa, her baby sauna, or whatever. Her little incubator. And she also creates the heat that might possibly begin to melt away some of this fascial tension that the babies have in the front part of the body, or muscular tension, or this tight musculoskeletal posturing. So that's where the baby really belongs, especially if the baby's really tight to begin with. Mother can't act as the baby's, loosener up just by heating that baby up with her own body. And also the relaxation, keep taking that baby out of that fight or flight response.
The safety, that baby feels safe when it's next to its mother.
Right. So, and that sensation of safety, the sensation of being protected, and the baby begins to let go and truly relax. And, one thing leads to the other.
And I want to say, it's really amazing that the hospital you work at does skin to skin after a surgical birth. I don't know how common that is, but I think that's amazing, and that you're a part of that. Yeah. And you're there, if mom isn't physically able to hold the baby, you're there to kind of make sure the baby is going to stay put.
Yeah, I stand there and supervise as much as I can, and I also instruct the father who'll be right there with her on what to watch out for. I mean, I'm doing a lot more. I'm actually watching baby's breathing, baby's color. Those are all the things that we kind of keep an eye on while that baby's doing skin to skin contact immediately after its cesarean birth.
Yeah, that mom's still getting stitched up. Like she's still currently in the OR, and you're there helping with that.
Yeah, I don't know of too many other places that do it. In fact, I don't know. I can't think of one in New Jersey that does it.
Wow. And this would be amazing if more hospitals brought this into their practice, right? I mean, it's so logical as long as the baby is not needing any medical attention, right? This is the best place for them to be.
Right. Correct. And it requires training, and it requires a little staffing, and also the willingness of, for example, the anesthesiologist to allow that, and the surgeons to allow that. And so it was a buy-in from all ends. They really had to be wanting this and be open to it. And when they see the benefits of it, it's really interesting to observe the physician's responses to the interactions between mother and baby right there on the OR table. Some of them are quite moved by it, and they're very surprised by it. Something that they had never seen before. So since you have never experienced it, you don't have an opinion about it, and you may even be resistant to it. But once they see how happy the mother is, how she forgets about what's happening on the other side of the screen, they begin to almost like they're proud of the fact that we do this.
Yeah, it brings joy.
Yes. Yes, and also to the father, your father's right there, and he's watching the interactions, and sometimes it's very often, many tears of joy in those moments. That is a precious time that they will never forget.
Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars, and the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it, and I absolutely love it. And you can never get it back either. That first hour, man, that's precious.
That's the sad part about it. And unfortunately, but for all those mothers who might be listening who didn't have that experience, I always say you can always recreate that time. You can always start again and put that baby, even if it's 2 or 3 or 4 hours later or whenever, the next day. Sometimes we have moms who are separated from their babies 24 or 48 hours for whatever reason. Let's start again, skin to skin. It's a fresh starting point. And it's like pressing that reset button.
That's amazing for moms with their serotonin, all these different hormones to help with avoid postpartum depression, right? Like it's calming the baby, but it's also calming mom, right? It's like they're healing each other.
And that's something we really need to be discussing a whole lot more, and heightening, underlining the importance of that time. It is
the oxytocin. Yeah, it's so important. And like you said, there's sometimes that opportunity is not available. Maybe the baby has a medical issue that they have to manage immediately after the birth. But it's never too late to.
Or the mom has a medical issue that has to be managed. So we here in the hospital that I work in, basically the promoter, the safeguarder, and the builder of a new beginning. No matter what the very, very first beginning was, we tried to get that mama and baby to have her special time for the first time again. And I can tell you so many times when there was a medical issue, even it could be the mother, it could be a serious medical issue for the mother. She even sometimes has to go to the intensive care unit for a little while. And then we have to bring her back up here. And that's when we bring that baby back into the room and we place that baby in skin to skin contact for the first time. Sometimes it's 24 hours later. Sometimes it's 12 hours later. But it's treated as if it was the first time. It's really important.
So let's talk about how that directly impacts feeding.
It makes it a little harder for the baby because if the baby has already been fed, like that mother-baby separation that I just mentioned, well, the mother, if we didn't have any hand express colostrum, if this happened overnight and we come in the morning, we have to go down to ICU, maybe hand express her. We don't know when the mother's going to be discharged from the ICU. So we'll bring up some colostrum to feed the babies, but most likely the babies will have already been fed some formula. Okay. So then the next piece of the action is like, let's make sure that we can get these babies to latch on. And that can, in fact, if they've received multiple artificial nipples, being bottle fed, then it'll be a little bit more, it could be, not always, but it could be harder to get the baby to latch on correctly because they imprint quickly into a way of using the muscles in their mouth.
Oh, yeah. So it's like a new pattern. They have to relearn.
let's just say that, it was twins. And mom had, a condition where she needed to be in the ICU for, and we bring her back up. Now it's two babies. Now we have to, first of all, the first thing that we deal with is the trauma. We have to acknowledge that this mother had fears for her own health. So there's that little piece of trauma, the separation from her babies. There maybe now I'm finally getting to meet my babies for the first time. There may be even a little bit of guilt on her part for not having done everything that she wanted to do from the beginning. So we have to have a heightened sensitivity to that. And then that is just getting those babies, simply getting them in skin-to-skin contact with no pressure to latch. Let's just put them there and see how mama responds, how she feels, and see how the babies respond. But it is kind of magical. When you put them finally in skin-to-skin contact, things get turned on in mama, things get turned on in baby. There are a sequence of behaviors that eventually lead for the baby seeking to latch on and breastfeed. Yes, we may have had a hiccup, but that's where I put my money, is in skin-to-skin contact.
Wow, it's that powerful.
Yes, it is. Hands down, nothing is more powerful than skin-to-skin contact to restore our relationship with your infant, to restore breastfeeding, to restore breast milk production.
Yeah, I was going to say milk production and microbiome, right? The good, and that's the same thing with dad. Even though he's not necessarily feeding the baby from his breast, his bacteria on his skin is healthy for the baby to be exposed to.
Yes, we can do skin to skin with dad. In fact, dad was taking care of the babies, in the scenario that I'm thinking of. Anyway, so one of the other, so yes, suppose that we have moved away from the hospital. Besides me working in a hospital, I also have a small I have a good private practice, seeing moms in their home. And we see that, sadly, there's this incredible, misinformation or conflicting information floating around in social media about how to take care of an infant or a newborn. One of the things that concerns me the most is the contraptions and where we place babies in, and the proliferation of items that restrict movement. Okay, we have a baby that was already in a tight spot. Let's say the twin babies. We are wrapping them up as tight as can be, where there is no movement. Baby cannot.
Baby burritos. Yeah.
Those baby burritos, which is a cute way of describing them. And they have so many beautiful little blankets to bundle them up and put them in and take beautiful little pictures of their sweet faces. They really certainly do look adorable, but it does not promote movement. It does not promote or allow the baby to show feeding cues. Okay. These hands are sometimes laid down to their side of the bodies, and then they're all wrapped tight so they can't move their hands from the sides of their body. And a baby needs his hands, yes, number one, to show feeding cues. Number two, to discover the world. How do we know a baby's hungry? Even if they're always tied, super tight. Oh, and the mom says, well, he's been sleeping for 4 hours. He's not hungry. He hasn't waken up. And I was like, I'm looking at the baby on the bassinet. And well, he is tied in 4 swaddles. And, very warm ones. So where do we think we are? Back in the womb. Some people might say that that's a good thing, but not, because the baby in the womb did not have to ask for food. He was getting fed automatically via the umbilical cord. And yes, he was in the snug, warm, floaty space, always hearing the heartbeat of the mother and the juices flowing through her digestive system. But now we're not there anymore. And now we need to ask for food. So we have to permit this baby to move a little bit, to show with its own hands, which he always had access to inside the womb. They were never strapped down. He was always sucking on the fingers and touching things and exploring its intrauterine environment, now we need to allow him to explore the outside world. We're no longer inside the womb. We are outside. Okay. And then, so just to get to know its environment and for the parent to be able to recognize feeding cues, we need to give him some freedom of movement. Sometimes I say to parents, if you have to fart really badly, or if you have to go to the bathroom really badly, think about all the movement that your body has to do to be able to pass gas or evacuate. And your baby is tied up. And I hear a lot of parents complain, my baby's always grunting. I was like, well, he's trying to go to the bathroom and pass gas without being able to move its body to pass it. They need some freedom of movement, even just for basic bodily functions. So that's another thing that I have observed. I said, just let them be a little bit looser. We're wrapping for warmth, but we're not trying to restrict their movement. And then the thing that comes up next is like, well, if I leave the arms out, the baby's going to wake itself up when he startles, right?
Startle reflex, yeah.
That Mora reflex is the bane of their existence because it's interpreted as a bad thing. Whereas it's actually a good thing. It's a healthy reflex that shows that your baby is sensitive to the environment. And if we put ourselves in the shoes of the first woman on earth, and she was holding this newborn infant, running through the woods, hunting, fishing, gathering berries, acorns, nuts. The baby was kind of like being jostled up and down, and feeling all this movement. And it would occasionally, or maybe even constantly startle. And the startle reflex, it opens arms open wide and out. And then they come back in and grab the hands, become a fist and pull on something. So it was a way of catching mama's skin, hair, clothing to hang on so that they could survive. So I explained to parents, the startle reflex is really, truly the original survival reflex. It was a way of hanging on, but it's meant to be integrated over time. And the only way this reflex integrates, if it's experienced. And if we were constantly suppressing because we're afraid the baby's going to hit its head or it's going to wake itself up, and we're always trapping those hands down, then we're delaying the integration of this reflex. We're keeping the baby from experiencing it so it learns that, I startled, but I wasn't really falling through the air. Or that was just a dog barking or the siren or a door slamming. I'm okay. I'm safe. And then they begin to understand the relationship of the body, the sense of self in relation to gravity and to the rest of the environment. So this is what I'm talking about, movement suppression inhibiting normal development.
Right. So do you ever recommend swaddles?
I recommend that if you're talking about a baby who is still meant to be in the womb.
Oh, a preemie.
A preemie. And you can recommend swaddling to help settle a baby that seems really unsettled. But after addressing all the other possibilities, was my baby crying because it's hungry? Is my baby crying because it's gassy? Maybe there's a tight piece of clothing, or maybe he just misses me, or maybe he needs to be moved and wiggled and jiggled. Maybe he needs movement. Okay, we try these things and then we can wrap them tightly to help them settle. Okay, there is an order of things so that we can make sure that we are addressing what this baby really needs, or it just needs to be hugged tightly against our bodies. That's what they really need. We're replacing swaddling with what they really truly need, which is the parental arms embracing them.
Human contact.
Yes.
And to your point, it can be dad too. It could be grandma.
It could be anyone. Grandma, I'm sure grandma's favorite job when it comes over to visit is snuggle and hold that baby in her arms. And that should be what she does. That's how parents get a break from the intense job that new parenting is. And when we lived in village situations, that was built into our society on the cultural norm. We know we have so many beautiful cultures in the area that we live in, where they have these long, ancient, 1,000-year-old traditions where the parents come over and help take care of the mama and the baby. Those are traditions born out of the wisdom of time and experience. And that is how to optimally support a family, having that, it's the primary figure of attachment for the infant is, the mother, the breastfeeder, the chest feeder, the partner. And then you have the inner circle, the immediate family. And then you have the slightly outer circle that supports the family. And in our current society, sometimes that is missing, which leads to the stress that many parents experience, that feelings of being overwhelmed would lead to them wanting something that's going to help them, like a magical contraption that will keep their baby quiet for a couple of hours. So again, in those situations, yes, use swaddling if it's going to help the parent get those extra couple of hours of sleep.
Completely sleep deprived, overwhelmed parents that are not that are unsupported, right? That's what we're talking about here. I mean, this is desperate measures.
and we need them, because we need a healthy mommy and a healthy papa to be able to function on a daily basis. But also it's just being aware that swaddling is not a goal. It's a means that we utilize to help us until our baby's brain matures in a way where it can sleep a little longer at night, and we start to get natural longer stretches of sleep. Also, understanding how an infant brain develops, and again, movement being one of the things that stimulates development and maturation.
Right. The cross crawl pattern is what connects the right and left hemispheres of the brain.
Right. Right. And also, so, I love baby wearing. Baby wearing to me is a compromise. It's a way a mother can get a few things done and the baby gets to feel snug and warm and protected without being stiff in a tight swaddle placed in a container. It's that way that we can actually meet both maternal needs and infant needs in a way that stimulates that maturation of the brain and that development. When a parent wears a baby and, let's say, goes out for a walk, that stride, that right, left, with the arms swinging, right? The baby feels that movement, similarly to the way it felt the movement inside the womb.
I'm so excited to share with you a company I recently discovered called Kindred Bravely that came into life in 2015 by Deanne Ackerson and Mama 2 when she couldn't find any comfortable or functional pajamas while nursing her second son. She decided to design her own, and this led to one of the best-selling pajama sets, the Deve Nursing and Maternity Pajama. As moms, we have to stick together, which is where Kindred comes from. And Bravely, being a mom can be super tough. It's not for the faint of heart. It takes a lot of courage, and that's where the name came from. At Kindred Bravely, they are devoted to making life easier for pregnant and nursing moms. From breast pads and non-skid socks to nursing bras and pajamas, Deanne creates every piece with comfort, beauty, and function in mind. And her designs have been recognized by multiple awards. Perhaps more important than her clothing is Deanne's mission to build a community of moms who support and celebrate each other. Go check out her website at kindredbravely.com and use the promo code WellAdjusted20 to save 20% off your purchase.
So, and it's that, again, like you said, that cross body, that alternating pattern of movement. So when the mother steps with one foot, the opposing side of the body of the baby holds itself a little tighter in the torso and the core muscles. And then when she takes the opposing step, the other side of the baby's body holds itself a little tighter. So it's getting a little mini core workout as the mother goes out for a walk. We're not even thinking about that, So, and baby wearing is one way to provide the baby with that feeling of safety and being snug and protected and getting movement and allowing the mother to do other things that fulfill her daily needs and do her daily errands and just even go outside for a walk and breathe some fresh air.
What about a mom who had a C-section? When is she physically able to start wearing a baby?
Well, it has to kind of like be something that it has to happen very gradually. Most moms who have a C-section don't feel like they can even put one foot in front of the other carefully till about the 5th day of life, and that's early. They're told not to go up and down stairs for, the first several weeks. And, they're basically told to check in with their OBGYN to give them the green light to do anything such as exercise,
Right. But what about like lifting and carrying a baby? Is that considered exercise?
Yeah, it is in a way, but she has to do what feels comfortable for her, and that doesn't cause pain. It's interesting because I also educate parents about how to protect themselves. Who after they've had a C-section, how to simply move their body, how to get out of bed. It's body mechanics. They need to be told, engage your abdominal muscles. They're all scared that their wound is going to open, right? So the way you protect it is you pull your belly in a little bit. Hold
belly button to the spine.
Belly button to the spine. Exactly. Pull it in. And now move one leg and then move the other. Now we can swing around and then put our feet on the ground, hold ourselves, still hold our belly, and then stand up slowly and gradually. Then take the 2 or 3 steps to the chair. Again, engage your abdominals, pull the belly to the spine, hold on to the chair, and slowly, gradually lower yourself to the chair. And if by simply engaging their core muscles with ease and proper body mechanics of movement, they're helping restore their strength. They're increasing the circulation to the area of the wound so that we speed up the healing. So movement, again, in the correct gradual manner will help heal her.
Right.
Did you get the theme?
I mean, you're speaking my language. Chiropractic is movement is life.
Right.
Once you stop moving, that's when you start dying. So yeah, it doesn't matter what's going on here. Our bodies are meant to move.
But people do need guidance.
How to do it safely.
Exactly. And sometimes because there isn't the guidance, they just don't do it.
Got it. Or if they do it and they do it incorrectly, they get injured and then they have to, heal from the injury. And then there's that fear of if I move this way, I could get hurt again. There's so many factors.
Correct. But I don't know the answer to your question. It varies tremendously from person to person because I've seen mamas here to have their 3rd C-section. They just get up out of bed and they go pick up the baby and walk around the room with the baby in their arms.
Yeah.
And I've seen women who can't take a step without holding onto their partner.
Right. Yeah. Everyone's experience is different. My hypothesis would be if they had a very, very long traumatic labor and an emergency C-section, they may even be more beat up physically, right? And more of a recovery is required to stand and move and lift a baby. There's a diastasis recti component. How separated are those abdominals? Is their pubic symphysis separated? Their hip joints. Right? All of that. Everything is required for weight bearing.
Yeah. So it's really, so this is where I, as a lactation consultant, because of my movement and dance background, I recognize a lot of these things because I've also had my own injuries and been treated and had work done, which raised my awareness and how now I see it through the eyes of someone who's trying to help parents parent and survive parenthood. And this is where I say, okay, I make the suggestion. You need to work with a pediatric physical therapist for your baby to help loosen up. You need to go see a chiropractor to help your baby be aligned, to move bone into place, to test for, asymmetries, all these subtle things that we take for granted, but that can have major impact on your baby's ability to feed correctly. So having, this type of work done is really essential for optimal feeding. I often think that the perfect combination could be one person who is both an IBCLC and a chiropractor.
Yes, and they exist. They're out there. I'm not one of them, but that's why I have you in my back pocket.
That's why we form collaborative efforts here. It's really important that we have each other, and then we can refer back and forth to each other as needed to optimize function for all of our mamas and babies and our dads too.
Yeah, the whole family benefits. And, we're talking about the tightness with the baby. We're talking about there's a neurological component of why babies have difficulty latching and feeding and moving. But we know that when that baby is relaxed and there is stress taken off that baby's nervous system and mama, right, then they're going to have an improved feeding relationship, right? The dyad will benefit from that.
One of the things that I tell parents is right off the bat, and they're so surprised to hear me say this, is start placing your baby in tummy time right away. They're like, what? But don't I have to wait for the cord to fall off? And I said, not necessarily. Your baby's just going to experience what it feels like to be on its tummy and feeling the forces of gravity on its body. It's going to move out of reflexes initially, but over time, those reflexes from experimentation, from trying, will become integrated, and then the movement will be deliberate and organized. And when we keep babies constantly wrapped up and immobilized, we are inhibiting that natural progression, or that timely natural progression.
Yes. And I think both of us have seen this link to torticollis, flathead, plagiocephaly, other issues that develop 2, 3, 4 months old.
Oh, yeah. Yeah. When these things are not addressed in a timely fashion, again.
Delayed milestones for sure. The baby's delayed in rolling, crawling, walking. This is like very basic. If you don't move, then you don't learn how to strengthen those. Yeah. So how are you going to roll if you're swaddled? You're not. Go ahead.
No, I heard something that made me healthcare. Recently, I heard out of the mouth of a healthcare professional say to a mom who was asking about doing tummy time right away. He said, "Oh, don't bother with it. They can't do anything until they're 3 months anyway." And I was like, wait a minute.
Wow, that's scary.
You're supposed, in fact, the American Academy of Pediatrics has a statement on the sleep statement that says that babies should be weaned away from swaddling by 6 to 8 weeks.
Okay, that makes sense.
Because then they can roll.
Right. That's when they're supposed to start practicing.
Well, but some of them might be strong enough to actually roll, which then puts, if their arms are down or pinned in, they put them in a compromising position, even putting them in further danger.
Right. And you can never put a swaddled baby face down, obviously. That's not safe. But I also have, issues with the back to sleep movement, where I'm seeing these babies with postural issues and cranial distortions because they're always on their back. Because parents are afraid that they're going to have SIDS if they put their baby on their belly.
Right. And so when you review, for example, the American Academy of the Academy of Breastfeeding, protocol number 6, if you look that up and you read it, it tells you how to manage nighttime and sleeping in a safe manner, including bed sharing.
Yeah, let's talk about that.
Which can be a little bit of it's a little frightening, but one of the reasons for parents that don't know and don't understand, but what's really important to understand is there are guidelines of the parents who do choose to share sleep. And let's go even one step before that. Why even do that? It's like, well, because a baby and Dr. James McKenna at the University of Notre Dame, in its mother-baby sleep laboratory, studied over the last over 30 years, I would say, mothers and babies sleeping in the same safe sleep surface attached to all kinds of monitors and being videoed, attached to a heart rate, respiratory rate, O2 stat rate, body temperature, and brain waves to measure light and deep sleep. Okay. All of this for both mom and baby. And the findings of his research show that babies and mothers coordinate respiration, heart rate, and sleep cycles. They're both in the same cycles of sleep and at the same time when they sleep in close proximity to each other. And they also move in relation to each other safely. They will move in their sleep, but the mother's always in what we call the cuddle curl position, which is a very protective position where her body's kind of creating this little nest around the baby. And she, even in her sleep, is very sensitive to the baby's position in relation to her body. And so when it's done according to these guidelines and these instructions, flat surface, no heavy blankets, a parent who is not intoxicated with either alcohol, street drugs, or narcotics, of any kind, that is conscientious, and has a cigarette smoke free or other type of smoke-free environment, this can be practiced safely, but, if not, it shouldn't be done at all. Nonetheless, again, this baby is going to sleep a whole lot better, will sleep much more comforted, won't wake up as often. There won't be any need for restriction. It'll roll into mom to side lie, breastfeed, and then it'll roll back onto its back when it's done eating. And then when it's hungry again, it rolls into its side, kind of half eyes closed, mommy half eyes closed, search for her baby latches on, and they both drift off to sleep. If it is done in a safe manner, it can be done. And it has been done since the beginning of time. And it's still practiced all over the world.
Right.
People think we're crazy to do this whole back to sleep campaign.
Right. And also there's in the US, this cultural, and it's crazy to bed share, right? It's like, well, people have been doing it since the beginning of time. And there are certain guidelines to do it safely, like you mentioned. I personally bed shared with my son the first 4 months of his life. I would have done it longer if my husband wasn't so sleep deprived. And I think people need to know that this is available to them. And especially for breastfeeding mamas, it made my life so much easier, and I had better sleep. And my baby and I both, I think, just enjoyed that bonding experience.
Right. Well, the importance of educating parents, giving information, stressing the importance of the baby being able to move, stressing the importance of allowing the baby enough freedom. I mean, it's not an all or nothing kind of a thing, but I think what's worrisome is when we observe a tendency towards more and more and more restriction of movement. And we do see the impact of it. So I do definitely want to encourage, all those out listening that when in doubt, go through your checklist and make sure that the baby's getting plenty of exposure to your mama movement and to be doing movement independently, to be placed on tummy, to be placed in surfaces where it can roll and move freely.
And safely.
Yeah.
Wonderful. Carmen, thank you so much for coming on the show today. I really appreciate you sharing all of your wisdom.
Oh, it's my pleasure to be able to be heard and talk to you and collaborate with you.
Thank you so much. Well, I hope you appreciated today's episode and really are beginning to recognize how everything is connected. No matter how old you are, whether you're a brand new baby or beyond, movement is life. And when we have limited mobility in our alignment, the soft tissue connected, muscles, joints, ligaments, tendons, fascia, we will see restriction and challenges with the way our body functions, as well as proper normal movement. So I love how, something as simple as even a breastfeeding baby needs to be able to move in order to feed, eliminate, and so on as part of their normal development. Thank you.